Okay, so are you ready to dive into some serious cases? We're talking mental health, and you've given us case analyses for abnormal psychology, so let's get into it.
Yeah, these cases really highlight how, mental illness impacts more than just the individual, right? It's like this ripple effect touching their family, their relationships. It's a lot.
It really struck me how the book emphasizes this integrative approach. It's like we used to think mental health was all in your head, but it's way more nuanced than that.
Right. It's this complex interplay of biology, a person's psychology, and the social factors. You can't separate them. Take, for instance, Ricky G's case, schizophrenia. Medication is essential, but it's not the whole story.
Mhm.
The book really dives into how crucial those social and psychological interventions are.
Absolutely, like group therapy to help him build those social skills that can be so tough with schizophrenia, and then vocational rehab to, help him regain that sense of independence. It's not a one and done situation.
Exactly. And when we look at the biological factors, schizophrenia is a prime example. It's like the brain's communication system gets a little scrambled, I guess you could say. The book really delves into the role of neurotransmitters, particularly dopamine.
It's fascinating how these chemicals can have such a profound effect on our experiences. Like with schizophrenia, you're not just hearing voices, your brain is actually processing them as real.
Right, and the book uses the example of dopamine, which is a neurotransmitter. Think of it as a messenger carrying signals between neurons in the brain. So, with schizophrenia, there's this idea of an overactive dopamine system potentially contributing to hallucinations. It's not just in their head, the brain is actually misinterpreting those signals.
Wow. And it's not just dopamine, right? There's a whole genetic component to schizophrenia as well.
Mhm.
The book even uses twin studies to kind of illustrate this point, which I thought was really interesting.
Right, and that's where the idea of concordance comes in. So basically, it's looking at the likelihood that if one twin has a certain trait, the other will too. Identical twins share almost all their DNA, while fraternal twins are more like regular siblings. And studies have shown much higher concordance rates for schizophrenia in identical twins.
So genetics play a huge role,
Mm.
but it's not like a guaranteed sentence, right? There are other factors that determine whether those genes are actually activated.
Definitely. It's this complex interplay of genes and environment. And we see that come up again and again in the book, like with bipolar disorder. Sally W.'s case really highlights the extreme highs of mania and those crushing lows of depression that characterize this disorder.
It's amazing to me that lithium, which is a naturally occurring element, can be such an effective mood stabilizer, especially for those manic episodes. It really makes you appreciate the power of, these natural elements. But as with all medications, there can be side effects.
Absolutely. Lithium isn't a one-size-fits-all solution, and Sally's case really emphasizes the importance of that therapist-patient relationship. It's not just about meds, it's about building trust, communication.
It's about that human connection, which is so important. And that really comes through in Carl V's case, who's dealing with borderline personality disorder. His therapist faces this unique challenge because of Carl's tendency to engage in splitting.
Yeah, splitting is a common defense mechanism in BPD. Basically, they see people as either all good or all bad, and it can make maintaining stable relationships, especially in therapy, really difficult.
That's got to be so challenging to navigate for everyone involved. And it makes you realize how crucial empathy is when it comes to treating personality disorders.
For sure. The book highlights dialectical behavior therapy, or DBT. It's been really promising for treating BPD. DBT focuses on teaching skills like emotional regulation, distress tolerance, really giving them the tools to handle those really intense emotions.
It's like giving them a toolbox to navigate life's ups and downs.
Huh.
Speaking of which, I think a lot of people can relate to intrusive thoughts, even if they haven't been diagnosed with, say, obsessive compulsive disorder.
Yeah.
But Margaret H's case, her experience with intrusive thoughts and those compulsions, it's on a whole other level.
Right. It's one thing to think about germs, but her fear of contamination controlled her every move. Those cleaning rituals, while they gave her some relief, they ended up consuming her life.
OCD can be so debilitating. It's like being trapped in this cycle of obsessions and these compulsions that just feed each other. But the book does offer some hope, right? It talks about cognitive behavioral therapy, specifically exposure and response prevention.
Yeah, exposure and response prevention. So for Margaret, that might look like touching a doorknob and then not immediately washing her hands. The idea is to break that link between the fear and the compulsion, essentially retraining the brain.
Retraining the brain, that's fascinating. And it's not just individual therapy, right? The book stresses how vital family involvement is for treating OCD.
Absolutely. Family plays such a big role, but they need guidance. It's a delicate balance. Imagine trying to help someone with their compulsions without accidentally making them worse.
That's a good point. It's like mental illness doesn't just impact the individual, it ripples outward. And that need for understanding and support, it becomes even more crucial with eating disorders. Sarah O's case, she's battling bulimia nervosa, and it's a reminder of how secretive and shameful these disorders can be.
And it's rarely just about the food. It's often about control, body image, those deeper emotional struggles.
The book describes this really difficult cycle of binge eating and purging. And it made me think about the role of serotonin, you know?
Uh-huh.
It regulates mood, appetite. The book mentioned it in relation to bulimia and how some medications that impact serotonin can help.
Serotonin is so important. When our serotonin levels are off, it can really throw things out of whack. And it's like researchers are putting together this puzzle piece by piece, figuring out how these neurochemicals influence our mental health.
It's amazing how much we're learning about the brain, but it feels like there's still so much we don't know, especially with something as complex as autism spectrum disorder, where the presentation can vary so much.
Absolutely. Jacob T's case really highlights that. Same diagnosis autism, but it looks so different from person to person.
And that's why the book emphasizes a person-centered approach. You can't just try to fit everyone into the same box.
Exactly. Each person with ASD experiences the world in their own unique way.
Yeah, and panic disorder. Those attacks can feel like you're being completely overwhelmed, like your body is just taken over. Letitia Q's case from the book, it really shows how these panic attacks, they can just hijack your body and mind, and often it seems like there's no reason for it at all.
And it's fascinating, isn't it, how those physical symptoms, the racing heart, the dizziness, they can actually feed back into the panic itself, like a vicious cycle. It is. It's like a vicious cycle. The fear of having another panic attack, it actually increases the chance of it happening. But there's good news here. The book talks about how effective cognitive behavioral therapy, CBT, can be for managing panic disorder.
So with CBT, you're basically learning how to challenge those anxious thoughts, those what-if spirals that can really take over. And the book talked about something called interoceptive exposure.
Yeah. So interoceptive exposure, it's about confronting the physical sensations that usually trigger your panic. So let's say you get panicky when you feel short of breath. With interoceptive exposure, you might intentionally try to make yourself a little short of breath in a safe environment just to realize it's not dangerous, just uncomfortable and you can handle it.
You're kind of retraining your body to react differently. And sometimes medication can be helpful in that process too, right? The book mentioned antidepressants, SSRIs specifically, being used for panic disorder.
Yeah, they can be really helpful, especially at the beginning when the anxiety is really intense. It's like giving someone a little bit of support while they're learning those CBT skills to manage their panic.
It's about finding that right combination of tools. That's so important. And, while panic disorder is often triggered by these internal sensations, with PTSD, the trigger is external trauma. Paul H's case, she's dealing with the aftermath of a violent assault. It's a reminder of how deeply trauma can affect someone, even if you can't see those scars.
Paula's story is so powerful. She was having nightmares, flashbacks. She was constantly on edge. That's hypervigilance, always waiting for the next bad thing to happen. And it's something that can really take hold of your life after you've experienced trauma.
Yeah, it's like the trauma gets imprinted in your memory and it just keeps replaying.
Right.
And it can make you feel unsafe even when you're not in danger anymore. The book talked about the importance of trauma-informed care, which makes sense.
Trauma-informed care is so important. It recognizes that the traditional way of doing therapy, like just talking about your feelings, it might not be right for someone who is still processing a traumatic experience. It's about creating that safe space to heal and giving the individual the power to feel in control again.
And it's not all on the therapist, right? Support systems are crucial for recovering from PTSD, aren't they?
Absolutely. Having people you can rely on, people who can validate what you're going through, it can make all the difference. It's about combating that loneliness that often comes with PTSD, reminding yourself that you're not alone.
And speaking of feeling fragmented, the last case in this section delves into one of the most complex mental health diagnoses, dissociative identity disorder, or DID, which we used to call multiple personality disorder. Grian C's case is a powerful example of how DD, which is often rooted in childhood trauma, can manifest.
In Breed's case, she experienced these distinct alternate identities, what we call alters, and each of them had their own memories, their own way of acting, even their own voice.
It's like the mind is trying to shield itself from intense pain by creating these separate compartments.
Exactly. It's a defense mechanism, a way to survive. But it's important to remember that even though these alters might feel like separate people, they are all part of one person. Each alter holds a piece of the individual's life story.
It really makes you think about the nature of identity. What does it even mean to be oneself when your mind has sort of fractured into these distinct parts?
That's a question philosophers and scientists have been debating for ages, and we don't have a clear answer. What we do know is that DID is a real disorder, often sensationalized in movies and TV, and it requires specialized, compassionate care.
And like with any complex disorder, getting an accurate diagnosis is crucial. But the book mentioned that diagnosing DID can be really tricky. It's often mistaken for other conditions.
It's true. You need a skilled clinician who understands DID and is sensitive to the nuances of trauma and dissociation. It's about recognizing the difference between normal personality variations and the truly distinct identities that are characteristic of DID.
It's like a detective piecing together clues from someone's past, their symptoms, and their own personal experience. And it really emphasizes how important it is for individuals with DZD to have a therapist who truly gets it, who approaches their care with respect and empathy.
Exactly. You have to validate their experiences, help them make sense of their own internal world. It's about empowering them to heal and integrate.
As we talk about these really complex cases, it's important to remember we're talking about real people, not just diagnoses. Each person we've talked about, Rookie, Sally, Carl, Margaret, Sarah, Jacob, Letitia, Paula, and Bride, they all have their own unique stories, strengths, and challenges.
You're so right. It's easy to get caught up in the labels, but behind every diagnosis is a human being, and they deserve compassion and understanding and support.
And often that support comes from their families. That's a recurring theme in these cases, how vital family support is for mental health recovery.
100%. Families can be amazing sources of strength. They can provide practical support, emotional support, and be advocates for their loved ones. And they can offer that safe and stable environment, especially when things are tough.
It's not always easy, though, right?
Right.
The book talked about some of the challenges families face. The emotional burden, financial strain, the stigma, even the fear that they're not doing enough.
It's a lot to handle, and it really shows how important it is to support and educate families who are dealing with mental illness. They need information, resources, and a sense of community so they don't feel so alone.
It's like they're on this journey, too, alongside their loved one, and they need a map and maybe a compass to find their way. And sometimes they need someone there to lend a hand.
Exactly. That's where support groups, family therapy, educational resources, those can all be game changers. It's about giving those families the tools and knowledge they need to support their loved one's recovery.
It's about building that network, not just for the individual, but for the whole family. Because when one person is struggling, it affects everyone. And when one person heals, everyone heals.
That is so well said. It speaks to how interconnected mental health is. It impacts individuals, families, communities.
It reminds us that mental health is everyone's business. We all have a part to play in creating a world where people feel supported and understood when they're struggling with mental health.
I completely agree. It starts with challenging our own biases, educating ourselves about mental health, advocating for policies that make quality care accessible to everyone.
It's about changing how we talk about mental illness, moving away from silence and stigma and toward openness and acceptance.
Exactly. Mental illness festers in the dark, you know? It's time to shine a light on it, talk openly and honestly, and create a world where getting help for mental health is just as normal as getting help for your physical health.
It's about making it normal, breaking down that stigma, and creating a culture where people feel like they can ask for help without shame.
And that's how we create real change, by being empathetic, promoting understanding, and making the world a more inclusive and supportive place for everyone, no matter their mental health.
I love that. And you know what? We've covered a lot of ground, haven't we? From the biology of schizophrenia to the intricacies of treating borderline personality disorder. But there's one more fascinating area I'd like to explore before we wrap up this deep dive, and that's the connection between mental and physical health. It's easy to think about mental health and physical health as separate things, but they're so interconnected. Even the book mentioned how antidepressants can help with some physical symptoms in panic disorder.
Absolutely. It's a two-way street. Stress can show up as physical symptoms, like headaches, stomach problems, and mental health conditions can actually make you more vulnerable to physical health problems down the line.
It's like saying your body keeps the score. We can't just ignore the effects of trauma, stress, or untreated mental illness on our bodies.
It's true. Think about Paula's case, the one we were talking about earlier. Her PTSD, which stemmed from that violent assault, wasn't just messing with her mentally and emotionally. It was affecting her sleep, how much energy she had, even her immune system.
It really makes you wonder about the role of those stress hormones, like cortisol.
Yeah.
If your body is constantly in fight or flight mode, it's going to have consequences.
Exactly. And it's not just PTSD either. Research has shown a link between chronic depression and a higher risk of heart disease, stroke, even some types of cancer.
Wow. It's like our mental health and physical health are two sides of the same coin. You can't really address one without the other.
Right. And that's why taking that integrative approach we discussed earlier is so important. You're not just treating an illness, you're treating the whole person, mind, and body.
It's about looking at the whole picture, understanding that every part impacts the others.
Yes. And that includes those social determinants of health things like poverty, discrimination, lack of education, lack of access to resources. Those can have a huge impact on both mental and physical health.
It's true. It's about acknowledging the systemic issues that can prevent people from being as healthy as they can be.
Exactly. If you want a truly healthy society, you need a multifaceted approach, one that addresses those bigger systemic issues that create these health disparities in the first place.
It's a big task, but so important. As we've gone through these cases, one thing is so clear. There's no cookie-cutter approach to mental health care.
Definitely not. Everyone is different, and so are their experiences with mental illness and how they recover.
It's about recognizing that each person's experience is unique. Their treatment plan, their background, everything. Empowering them to be a part of their own healing is so important.
And it's about recognizing that recovery isn't always a straight line. There will be bumps in the road, challenges, times when you want to give up. But having support, believing in yourself, and having that willingness to keep going, that's how you make progress.
Those little victories along the way, they matter. Each step forward, no matter how small, is a step worth taking.
I love that. And it's a good reminder that we all have a role to play in building a world where mental health isn't just something we talk about, but something we truly value and embrace.
This has been an amazing conversation. I've learned so much today. And for everyone listening, I hope this deep dive has given you a better understanding of just how complex mental health is. Remember, recovery is always possible.
Absolutely. One step at a time.
It's easy to compartmentalize, think of mental health and physical health as totally separate, but they're so intertwined. Like the book mentioned, sometimes even antidepressants can impact physical symptoms, like in panic disorder.
It's definitely a two-way street. Think about how stress can manifest physically, right?
Yeah.
Headaches, stomach issues. And then on the flip side, mental health conditions, they can really increase your risk for certain physical problems.
That's like our bodies keep track, even when we don't realize it. That saying, your body keeps the score, it really resonates here. We can't ignore how trauma, stress, or, untreated mental illness, how those impact us physically.
Exactly. Remember Paula's case with the PTSD after the assault. The book pointed out how it wasn't just her mental and emotional state, it was affecting her sleep, her energy, even her immune system.
It makes you think about those stress hormones, like cortisol. If your body is constantly in that fight or flight mode, it's got to have some wear and tear.
Absolutely. And PTSD isn't the only one. Studies have shown a strong connection between chronic depression and a higher risk of heart disease, stroke, even certain cancers.
It's like they're two sides of the same coin, really. Mental health, physical health. You can't truly address one without thinking about the other.
And that's where, like we were talking about before, that integrative approach is so essential, treating the whole person, mind and body, recognizing that every aspect impacts the others.
It's about moving away from those separate boxes and seeing the bigger picture, that more holistic view of well-being.
Exactly. And that means thinking about those social factors too, right? Poverty, discrimination, lack of access to education and resources. Those can have a huge impact on both mental and physical health.
Absolutely. We have to acknowledge the systemic issues that can really hold people back from being truly healthy.
Yeah, it's about creating a society where everyone has the opportunity to be as healthy as they can be. And that takes a multifaceted approach, one that tackles those bigger systemic issues that are at the root of those health disparities.
It's a huge undertaking, but so critical. Going through these cases, it really hits home that there's no one-size-fits-all in mental health care. Every person is unique.
Right. Everyone's experience with mental illness, their journey to recovery, it's all going to be different.
And we have to honor that individuality, don't we? tailoring those treatment plans, taking their background and experiences into account, giving them the reins, empowering them to be a part of their own healing.
Absolutely. And recognizing that recovery, it's not always this straight line, you know? There are going to be setbacks, challenges, those moments when you just want to give up. But having a good support system, believing in yourself, and just that willingness to keep putting one foot in front of the other, that's how
Uh-huh.
you get there.
It's about celebrating those little victories. Each step, no matter how small, it all adds up.
I love that. It's a good reminder for all of us. We all have a part to play in creating a world where mental health isn't just something we talk about, but something we truly value and embrace.
This has been such an insightful conversation. Thank you so much for joining me today.
Thank you for having me. It's been a pleasure.
And to everyone listening, thank you for joining us on this deep dive into the world of mental health. We hope you learned something new and maybe even feel a little bit more hopeful knowing that recovery is always possible, one step at a time.